I keep on saying that here at the Fancy Food Show, we find out what's coming next. And with us, we've got Dr. Jonathan Deutsch from Drexel. I am a proud Drexel graduate myself. Tell us a little bit about the Drexel Food Lab and what are the trends that you're seeing and really focused on?
Sure. The Drexel Food Lab is a research lab in our Center for Food and Hospitality Management at Drexel. And we engage our students and other faculty in solving real-world problems around good food product development and culinary innovation. And we draw a very big tent when we're talking about good food, but some aspect of sustainability, health promotion, and access. And in each of those areas, we're seeing a lot of activity. Initially, we thought this will be sort of a feel-good, kind of charitable enterprise, and big business won't be interested, but we'll kind of do our little corner of the market. And what we're seeing is everyone from startups through multinationals are focused on those issues. So in sustainability, a big focus has been upcycling, and I expect to see a lot of upcycling brands here. I just saw an article today in Fast Company listing 20 innovative upcyclers. In health promotion, what I'm presenting on today is around food alternatives to drugs. Taking it one step beyond general healthy food and actually getting people off of pharmaceuticals, which often have side effects and other complications apart from price, and looking at developing specific food to target certain disease states. So we'll talk about that. And then in access, it tends to be a lot about allergens, both preventing allergens, working from infant on to prevent allergens, to make allergen-friendly foods, and then affordable foods, making specialty food not the domain of the elite shopper, but looking at opportunities for everyone.
So I recall a couple of years ago, and I forgot which university was involved in this, but up in the Boston area, what they actually experimented with in a hospital, they gave fruits and vegetables to patients and got them weaned off the drugs, and actually the health outcomes were better, and obviously the cost of healthcare was reduced substantially.
Right. Many hospitals are doing that now. It's called a prescription produce program. And what they're seeing is for patients who don't have good access to medical care, especially in low-income neighborhoods, the ER, the emergency room, replaces the primary care physician for many families. And a lot of the things that are coming in, that patients are coming in with, of course they're dealing with trauma and major injuries, but a lot of times it's preventive health kinds of issues where ER docs are actually screening for food insecurity along with the other intake, which seems so basic. It's a 2-question screening. Have you had enough to eat? Are you worried about being able to afford food? But in addition to the 10 forms you get about whether your great-grandmother had glaucoma, here's a really simple question and can prevent. And that's also tied into the sort of food waste phenomenon that we're seeing, where we're concurrently, as people are food insecure, we have 33 to 40% of our food being wasted. A lot of that is fresh fruits and vegetables that are ugly, that are overripe, and of course overripe means the peak flavor, right? So just kind of connecting those dots, I think, can do wonders.
So, and this might be very naive of me to ask, but is the problem the way physicians are trained, that they're really not trained to prevent, they're trained to fix an ailment? So here, you have a problem, here, take a pill, or here's an injection, versus really going back and looking at how people are eating.
Absolutely. I think that's a big part of it. I talked to a number of medical school deans and faculty and students who say things like, oh, well, we have a day of nutrition. One day out of 3 or 4 years, and 4-hour lecture. And I don't know about you, but I don't retain a lot from a 4-hour lecture, right? So it's really not integrated. They're getting a little bit of nutrition, and they're not starting with food. Now, that said, there are some positive strides. We're seeing more integrative medicine and preventive medicine programs. We're seeing culinary medicine courses. At Drexel, there's a culinary medicine club that's been very actively engaged with us to try and right some of these wrongs. But I do think it requires a big shift, and a lot of the work we're doing is just to have physicians think before they reach for their prescription pad.
Yeah.
Is there a food solution that could work maybe in concert with a pharmaceutical? It doesn't have to totally replace it.
Right.
But is there a way to say, instead of saying, here's your prescription for X, can you say, let's talk about lifestyle, let's talk about diet, here's your prescription for X, and here's how to get off of it with these changes that may happen currently?
Well, is one of the problems capitation, so that you have these docs who, get something from the health plan that says, you've got 3.5 minutes with this patient. So the docs are under pressure to write that script and get them out as quickly as possible?
I think that's part of it. I think I think education is part of it. I think there's a lot of onus on the patients too. I mean, we are used to saying, hey, my blood pressure's high, my cholesterol's high, what can you give me for that? And
Right.
we're also looking for a quick fix, right? And no one wants to hear, well, let's start by having you undo the last 30 years or so of your bad habits,
Right.
and let's get on the right. It's much easier to, we thank God we have health insurance, we take that script to the pharmacy,
Right.
It's not unreasonably expensive for many people, and here's the solution, right? So I think it's a systemic problem, and I think part of it is we need to develop food products that are appealing, that taste good, that fit into people's lifestyle. It's not reasonable to take a patient who has not had a healthy lifestyle, not been doing things, and expect them to start tomorrow to cook healthfully, to run, to do all these
Right.
things that our physicians might do.
Right.
And that's one of the opportunities that we're really emphasizing here is we have to meet people where they are. We have to say, okay, we all know that we're spending more of our dollar on food outside the home than in the home. I know that the best prescription for you might be to cook brown rice and beans every night, but I know and you know that you're not going to do that. So what can you look at all of these booths and all of these vendors? What can you do in your current environment at the convenience store, at the drugstore, at the supermarket to kind of integrate some of those changes now, and not just doing what nutritionists do, which is say, choose this, don't choose that, but also as food product developers and as the specialty food industry, can we start to make some of those products, invent some of those products that may have never been conceived of before?
So last question, Geno's or Pat's?
Pat's, always.
I'm with you. We're going to take a break. When we come back, a lot more right here from the Summer Fancy Food Show.